Society spends 90% of its time obsessing over how breasts look, completely ignoring the physical, daily reality. For the person actually living with them, the daily experience is strictly functional. It means managing chronic discomfort, fighting inadequate support, and dealing with lingering health anxieties. We are told there is a standard, ideal size, usually somewhere between a 32 and a 40. But expecting a single, rigid numerical standard to accommodate the vast range of natural human biology is structurally flawed. This chart breaks down breast care into effort versus impact. If you spend your time down here guessing standard sizes, you get very little return. Staying in that guessing phase guarantees high friction and poor structural support every single day. But look up here. This high-impact quadrant requires learning your exact anatomical shape and mapping it to a garment built specifically for that architecture. That exact same process of understanding your anatomy gives you the baseline knowledge required to monitor your long-term physical health. Comfort and health do not come from altering your body to fit a media trend. They come from matching your unique biological framework with the correct physical support. Moving past the obsession with standard cup sizes starts with identifying your specific structural shape. Biologically, there are 5 core anatomical variations. This diagram illustrates the first variation. Round breasts have an even distribution of tissue, meaning they are equally full at both the top and the bottom. Because the volume is evenly distributed, this shape naturally fills out a standard cup. But that density creates a heavier tissue weight, demanding targeted vertical support to keep the straps from digging into your shoulders. Next are the bell and teardrop shapes. Notice how the volume concentrates at the base, leaving the upper chest relatively flat and narrow. If you wear a standard plunge bra with this weight distribution, you will constantly experience gapping at the top of the cup, because the fabric is built for volume that simply isn't there. Then we have the side set shape. The tissue points outward, leaving a distinct, wider space flat across the center of the chest. Without a garment designed to gently pull that tissue toward the center, this outward orientation causes uncomfortable overspill directly under the arms. Finally, the asymmetrical shape. It is completely standard to have one side noticeably larger or shaped differently than the other. Volume shifts after pregnancy, weight fluctuations, and differing nipple directions are entirely standard biological realities across all 5 of these shapes. Identifying exactly which framework you have is the mandatory first step to resolving the friction of getting dressed every day. Once you know your shape, you have to apply the correct structural engineering to actually support it. This decision tree maps the solutions. For a round shape, the absolute necessity is wide strap architecture to distribute the heavy vertical load and prevent deep shoulder grooving. If you have a bell or teardrop shape, you need heavy bottom lift designs. A balconette supports the lower weight directly from underneath, without requiring you to fill out upper cup fabric. For side set biology, the solution is structured side paneling, or a gentle push-up mechanic, to safely guide the tissue to the center and eliminate side spell. And for asymmetrical shapes, the strict protocol is to always size the garment so it perfectly fits the larger side. The trade-off here is manual effort. You have to use easily removable padding to fill in the smaller side. It takes more work in the morning, but it maximizes long-term comfort. Achieving a completely flush fit against your chest, with no gaping or digging, means you have to test different band and cup combinations. You have to entirely ignore the legacy sizes you used to rely on. Throwing away expensive garments that fit poorly is frustrating, but discarding them is a necessary trade-off to finally lock in proper daily structural support. During dynamic movement or heavy, high-impact exercise, your baseline structural support cannot protect against long-term tissue damage. High-compression sports bras are often expensive, but they are a mandatory investment to prevent your internal ligaments from permanently stretching out. Beyond daily support, the ultimate tool for proactive long-term health monitoring is the tactile breast self-exam. Looking at this flowchart for the monthly protocol, Step 1 is establishing your physical baseline. You do this by conducting a manual exam in the shower once a month, where the slippery surface makes it easier to feel the tissue. Step 2 requires methodically mapping the entire area so you understand exactly what your normal density feels like. Once you have that baseline mapped, Step 3 is simply checking for new anomalies that deviate from your established normal. Finding a lump creates immediate psychological anxiety. While many structural changes or cysts are completely benign, any physical anomaly that persists for more than a month requires immediate verification by a doctor. And on a surface level, minor occurrences like stray hairs or localized pimples are biologically normal and easily managed with consistent skin hygiene. Investing a few minutes into rigorous support protocols and routine self-exams prevents irreversible structural damage and cuts through the anxiety of the unknown. The entire goal of breast care is functional, biomechanical alignment. It is not aesthetic perfection. To optimize both your comfort and your health, look at this 3-step checklist. If you are optimizing for daily comfort, step 1 is abandoning arbitrary cup letters and identifying your specific biological shape. Step 2 is matching that exact shape to the structural architecture of a garment, prioritizing firm support over temporary style trends. For the health pragmatist, step 3 is committing to rigid dynamic support during exercise and locking in a 3-minute tactile exam every single month. The only truly abnormal behavior here is expecting a single piece of fabric or an arbitrary media standard to perfectly accommodate every biological variation. Your baseline anatomy is entirely normal. Your only requirement is making the deliberate time investment to understand and support your specific framework.